My name is Dr. Monica Flores. I'm a pediatrician in South Florida. By now, I hope you have updated yourself on the coding changes made by the AMA effective January 1st, 2021 in coding by time and in medical decision making. These set of videos are going to apply those guidelines to bread and butter cases that we see every day. Please keep checking for updates, as these guidelines are still in transition. Only by educating each other can we master these changes and optimize our revenue. I am not a coder, but I have had an interest in coding since residency when my notes were torn apart, not only by my attending, but the certified coder who worked in-house at the Mayo Clinic. Since then, I've read every publication and have attended multiple workshops and conferences in order to educate myself and optimize my billing. In addition, I've been through several audits, and with the help of a certified coder, I have come out ahead. Once again, I cannot stress enough the importance of noting the time even before opening the chart. This case is once again a telemedicine visit, this time to review the labs ordered at the previous well visit. This patient had been followed since 2012 due to fatty liver and elevated BMI, with inappropriate eating habits and an inability to exercise due to a recent severe knee injury. I reviewed the labs, which showed abnormal liver functions, normal lipids, and elevated insulin, with a normal hemoglobin A1C and a low vitamin D. I made sure to note the date and the lab results. To make my life easier, I keep the notes in my chart of the chronic conditions, the specialist visits, the previous labs, etc. This helps in documentation of risk and decreasing the time it takes to review the chart, and serves to educate other providers who may be co-managing my patients. Once I have my face-to-face time with the family, I update the history and add any new concerns that may have come up. Since this is a telemedicine visit, my exam is very limited. But I do not worry, because with the new coding guidelines, history, review of systems, past medical, surgical, social history are no longer relevant to medical decision making. During my face-to-face time with the family, I address questions from both the caregiver and the patient, who is a teenager, noting that in my plan it is well in my history. I address problems one by one with the patient and the caregiver. I explain the lab results, discuss possible complications, address new questions, answer multiple questions, take into consideration any comorbidities, and then I document, and even with my shortcuts, this takes a significant amount of time. We can choose to code by either time or medical decision making. Since we addressed so many problems, let's see if we can meet a 99215. Remember, we have to meet 2 out of the 3 in either problems, data, or risk. In order to meet the criteria for 99215 in problems, you have to be basically at death's door, which thankfully was not the case. You need a high risk of morbidity in order to meet the criteria for 99215 in risk, which we did not meet. Since we need to meet 2 out of the 3 in problems, data, or risk, we do not have a 99215. So let's look and see for a 99214. Again, you need 2 out of 3 in problems, data, or risk. Maybe this time in risk we can meet the social determinants of health. We did dietary counseling, exercise counseling, we talked about inappropriate eating habit, but unfortunately social determinants of health are only Z55 to Z65. We do not meet a 99214 through the social determinants of health, but we do meet it through the, oh, by the way, since we gave him a prescription drug to deal with the seborrheic dermatitis, we meet the 99214 in risk. So that just leaves problems and data. In problems, you could make a case for a chronic illness with an exacerbation, since he had a history of fatty liver and now the liver enzymes are increased. Or this could be considered an undiagnosed new problem with uncertain prognosis, since his liver enzymes had normalized and now a few years later they were up again. Out of curiosity, would you have met data in 99214? You would need 2 out of 3 in either tests, documents, independent interpretation, or discussion with an external provider. The only way to meet the data criteria in 99214 would be to meet it in tests or documents, and in there you need it in 3 out of 4. We reviewed the external notes from the GI. We also reviewed the GI's unique tests, and we ordered tests, and we had a face-to-face discussion with an independent historian, which meets the criteria for data for 99214. Could we have gotten a higher code if we had chosen to code by time? We spent 5 minutes in reviewing the chart, 15 minutes in face-to-face discussion, and we also get credit for our documentation or if we discuss with external providers on the same day. In this case, I spent 20 minutes documenting. Once my documentation was done, I made sure to include a sentence that said that my total time on the same day in review of chart discussion and documentation of the note was 40 minutes, giving me a 99215. By keeping track of time, you'll avoid wasting brain power in medical decision making. I invite you to continue to work smart, increase your revenue, and give yourself more time to be at home with your families.